Hi, everybody. I think we got everybody in here. We're a couple minutes after 6, so we're going to get going. First thing I wanted to do is just thank everyone for being here. I'm Matt Austin Ford. I'm the county executive. We have our public safety team over here. We've been talking about the issue of ambulance service for years, and quite frankly, in the last few months, we've really been trying to keep a very close eye on it, wanted to, in those discussions, and as we were going through, the things that are happening, we really felt that it would be a good idea to get everybody in the same room and have a discussion. I'm hoping that we can really focus on, where we're at in the county and, where we're going, and, what role could the county play in that, in being a support system for folks in this room, and ultimately, as we've said a number of times, of all the things we do at the county, what's more important than trying to ensure that when someone calls 911, there's a response in a reasonable time, which certainly that's high up on the list. And this is a very complex issue, as all of you know. And I think also it comes down to what are the expectations of residents. And I think depending on where you are, you have different expectations, whether it's more urban in the city of Amsterdam, more rural areas, as well as, is a community willing to pay more for better service? And one of the things that we've done, before we get into just a bit of an analysis of our current situation, because we actually been tracking response times from the end of October till just the beginning of March, and we'll talk about that in a minute. But as you look across upstate New York, there's obviously a number of challenges for rural EMS, and you see folks like Wayne County that are using their COVID money to start county-run ambulance service. You see other areas are trying to supplement services with advanced life support vehicles or fly cars. You see just even to our neighbors to the north, looking at contractual relationships. I'll 100% honest opinion for me today, I don't pretend to have the answers. I just wanted to look at what the options are, look at best practices from other communities, see how things were going for them, talk it over with our team, talk it over with people that are invested in these services, and try to chart a path forward. So that's where we're at. I really am thankful to the team for what they've done to try to not only educate me, but give everyone the information they need. So just recently, in that time period that we spoke about, from 10/24/21 to 3/10/22, we flagged, there was 2,605 calls. And of those 2,605 calls, there were about 1.5% flagged with potential delays, which I think in the environment that we're all operating in, I don't think that's too bad. And of those calls, those 1.5% calls, the average response time was 22 minutes. So, again, there's differences in communities, whether you're in an urban area or, a more rural area, but the quickest of those flag calls, the quickest response time was 3 minutes, and the longest response time was 68 minutes. So in us talking and just looking at the data, what stuck out to me in my initial opinion is that the folks that are providing these services are doing the best they can in a very difficult situation, but there might be some areas where we can improve and maybe improve those response times. And also, just by having this forum tonight, I was trying to gauge what the community feeling was. And I see a lot of folks in this room that are really tied in directly, but we did not get a ton of feedback in our office of people that were really upset about this issue, which I think is another sign that people that are providing these services are doing a good job given the entire situation. So tonight is a night to really share what your thoughts are. We're not going to sit here and do a big presentation and try to tell people in the room what we think. I'm really, I have some ideas, some thoughts. Particularly for me, I think, that mid-county area, from Palatine to, say, Fonda, might be an area where we can improve, but really not at this point, trying to say that I think we should do this, I should think we should do that. I think we've tried to educate ourselves on what options are available to the county should we have, a crisis situation. But I know that, we're all dealing with staffing issues. We're all dealing with resources being stretched too thin. So really tonight we want to hear from you guys in the audience on what you think, what your expectations for your county government are, and where you'd like to see EMS go in this county as we head into the future. So that's really where we're at. That we've not made any decisions about, we need to do X, Y, or Z. We want to just, and I know Jeff has been working with a lot of you about, trying to get some plans together, but that's really and truly where we are. So that's my spiel to kick this thing off. I'll turn it over to Jeff to say a few words, and then Rick and Jeff, and we'll take it from there.
Thank you, Exec. I just wanted to, first of all, thank you all for taking the time to come up here tonight. To reiterate what the executive said, we are far from the experts in EMS, and I say this all the time when we have our EMS advisory meetings when SAVAC and Amsterdam Fire and GAVAC are present. You are the experts doing the job each and every day. I also wanted to make sure that you understood that the Sheriff's Office really takes the information in and we dispatch it out. And that's really our role in this. The details that the executive shared are something that the dispatchers have been keeping track of since October 24th, when an ambulance advises us that there is a delayed response or that they need mutual aid because of a delayed response. So those are the calls he's specifically referring to. I also wanted to share a couple things that the Sheriff's Office has been doing to try to help the EMS providers and help the constituents in the county. Working with them, we changed our lift assist policy, and that involves police officers, deputy sheriffs, volunteer fire service now trying to help so that we're not tying up an ambulance on something that is really not a medical call. The dispatchers are encouraging the callers to try to get help from family members, neighbors, landlords, people like that, if it is a simple lift assist and nothing EMS related. So that was one thing that we did. The second thing is our 941. 941 of the mental hygiene law is when someone needs mental health services, and it's really an in-custody procedure by law enforcement. So no ambulance is providing those 941 transports anymore to St. Mary's for services so that we don't occupy an ambulance unnecessarily. The third thing is a flyer that was created that every agency in the county put their logo on, and we've tried to repeatedly share that on social media to try to educate the public of when it is necessary to call for an ambulance, to maybe try to reduce the unnecessary calls or the, we may refer to them as Band-Aid calls. Somebody still might need some attention, but it may not be actually necessary to tie up an ALS provider ambulance. So those things are things that we've done. Along with, we've purchased Priority Dispatch. We're in the process of a new CAD system, and we're hopeful that when they are deployed late this year, that they'll provide consistency, they'll provide more information to the EMS providers, and they can then target calls based on the emergency need or the providers that they have available, and better manage their personnel throughout the county, things like that. Through our EMS advisory meetings, a committee was set up with SAVAC, GAVAC, and Steve Cook, the county EMS coordinator, and we asked them to please get together, talk it over, and then provide a detailed report to us so that we can share it with the executive on what their thoughts are and their best plans to try to help resolve any potential issues and make improvements. That's another thing that we thought was very, very important. We think our EMS providers are doing a phenomenal job. When you look at these statistics and these numbers, yes, is one call that waits 68 minutes unacceptable? It is. We want to do better. But overall, they're really doing an awesome job with what they have. And let's face it, it's a supply and demand situation, right? We could have 10 ambulances on and not get a call. Or you could have all your ambulances tied up and get 7 calls at the same time that drop throughout the geographical areas of the county, and travel is a concern. And we've heard it from our providers, the delays at the hospitals, the lack of staff, the cost to operate. I mean, all the above are tools that cause part of the problem. We've updated our mutual aid plan based on input from the providers, all things to try to allow our dispatchers to help as much as we possibly can. So I want you to know that we want to be a good partner, we want to be part of the solution, and we're not just ignoring this. It's something that we understand that's important. That's why the executive offered to host this tonight, and I thank him for that, and I thank the college and our partners at Emergency Management do a phenomenal job managing with Steve Cook, his guidance through this process, and we're just here to continue to work hard to try to get to the end in a positive manner.
Yeah, and Jeff, as he said, has tried to do as much as he can within his office, but, we also want to be mindful that, if there's more that needs to be done, then we want to step up to the plate and do it, but we want to do it as a team. And I think that's what Jeff really is talking about here, is that, we are a partner, and we want to be a good teammate, and, this is the first step in trying to do that. Rick, did you got anything you'd like to add?
Good evening, everybody. Thanks, Matt. Just want to elaborate on a couple of things that the executive have stated earlier. All options that we put out on the table. One thing that we started with is I tasked Steve Cook to investigate and initiate the application for countywide CON, so that in the event we have to take other steps like fly cars or supplemental ambulances, that process has already started. We've been talking with other counties that have contracted services with ambulances. We've contacted other county executives to how they're setting their stuff up, and we've got all that stuff on the table. And as Jeff alluded to, that committee with Steve Cook and the ambulance services coming up with their own plan to how we can help settle this out. We're still waiting on that result, and once that happens, we'll get it up to Matt and we'll move forward from there. But, we need input from people in the audience. Thank you.
Great, thanks. Jeff?
I'll just reiterate, thank you, Matt. Thank you for putting this together. My name is Jeff Kaser, Emergency Management. Just want to reiterate that we're here tonight because we want to get together with the public to get their thoughts and ideas. This is all about planning, coordination, and communication. That's what we're here for tonight. We need the input from everybody. We need their ideas, their thoughts, so we can take this all back, put it into a big bowl and disseminate it, and come back with the best plan, because at the end of the day, we don't care what color ambulance it is. We don't care what it says on the side of it. We're here to protect and serve, and that's what we do as public servants. We want to give the best service to our citizens and our constituents that we have out there. So thank you very much. Thank you, Matt, for your time.
So from here, really, this is the chance to hear from everyone in the audience. Like I said, we're not trying to move forward one way or another. We're really trying to get information. The things that I'm particularly interested in are, for the current providers, how are you doing with staffing? I know it's tough, but, where are you now? Where do you see it going into the future? Another big thing is, we've had some discussions, and I know a lot of this is not reinventing the wheel, but it appears that a lot of the issues lie at the state level as well, with some of the reimbursement rates, some of the regulatory barriers. So, we really want to, hear what those issues are from you, so then we can then take that back, and I can start and continue to try to work with our state legislators and other county executives to try to build some momentum to get some of these things changed. So, we could do just a show of hands. We really want to hear from you tonight. So, if anybody wants to start off and kick off the discussion? I'll start off.
I would start out with thank Matt for putting this together here tonight. For those of you, a couple of you may not know who I am. My name's Steve Cook. I'm the EMS coordinator for the county. I've been involved in EMS in Montgomery County, both on the provider level and in different management roles since 1988. So I've got a pretty good idea of what's going on here in the county. And the first thing I want to say is I want to congratulate the ambulance services that we have on the coverage that they're providing. with this current situation that we are in. We've been very, very lucky that 1.5% is a fantastic number. The problem is EMS is in crisis in this county. It's pretty much been luck of the draw. And this next statement I'm going to make is a pretty serious statement. EMS as a fee-for-service structure is not a sustainable business model to run ambulance services. There's not enough money that comes in the door with insurance reimbursements to properly operate ambulance services. It's been like that for many years. We've been dodging that bullet for many years because we've had resources of volunteers. In New York State, over the past few years, we lost over 24 ambulance services, mostly because of finances. In Montgomery County, we lost the county ambulance, we lost Fond Ambulance. Our commercial provider chose to leave the area because of the market. Fulton County has lost Fulton County Ambulance, JVAC Ambulance, Broad Albin Ambulance. These are all resources that are all gone, mostly because of money. EMS is the only public service model that is not supported by tax dollars. Our fire service, both career and volunteer, is supported by tax dollars. Our law enforcement is supported by tax dollars. Our emergency management is supported by tax dollars. EMS is left to fund or to survive on our own. And it doesn't work anymore, people. It just doesn't work. And if we don't figure out a way to fund the ambulance services, they're going to go away. And then that 1.5% is going to climb. I have been working with Tom and Shannon, coming up with a county plan. That's in the works. The CON is in the works. Those are all going to cost money. And I just want to bring that up, that what this really comes down to is money. Ambulance services can't recruit EMTs and paramedics because they don't have enough money coming in the door. When a Medicaid call pays you $200 and it costs you over $500 just to open the garage door and pull the ambulance out, the math doesn't make sense. We're $8 to $10 an hour lower in this area on wages. We can't recruit people into the area to staff ambulances. They'll drive down the road to Saratoga or Schenectady or Albany County and make the bigger bucks there. We need to change that. So with that, I think we'll just turn it over to maybe Tom can fill in a little bit more on the situation on what's going on with Gavac and Shannon and go from there.
So, I mean, we're not going to fix this problem tonight. There's no question. This problem it's taken us years to get to this point. It is going to take us years to get out of it. And we can throw money at it, and that's going to help. That certainly is going to help. But we have to look at the bigger picture, right? We have to educate Matt and EMO on what it is that we do to operate an ambulance service. It's different than fire service. It's different than law enforcement. The fee for service, knowing insurances and things like that. That's the biggest issue that we have, is we have to educate the people, including the community, to understand what it takes to operate the ambulance service. In New York State, staffing is an issue in EMS. When COVID hit, a lot of us stood together and we pushed through it. As we started to see wage increases in other fields building, whatever, Walmart distribution, $32.75 to start. Who wants to work as an EMT for $15 or $16? Or a paramedic for $21, $22, $23, even $25 when you can go literally up the road and not have to worry about certain liabilities. So New York State looked at this in whole as a provider for the providers. There are currently just over 60,000 certified providers in New York State. Less than 30,000 actually work as a provider, whether that be a volunteer fireman, EMS provider in an ambulance, career firemen. So less than half don't even work in this field. They're doing other things, working at hospitals, ERs, doing telemetry, whatever. So that is a big problem. Enrollment in EMS classes is down 37%. Now that's enrollment. Even if you had 100% passing rate, which we all know is not realistic, your passing rate's more like 70%. Your enrollment into the class is already down 37%. So nobody is coming to this field, and I'm going to be honest, it's because of the wage, right? Like I said, who's going to do what we do for the amount that that we're doing it for? So, to reiterate, and we are, I say that all the time, EMS has been the redheaded stepchild of the whole emergency services, right? We've had no funding. Nobody even usually questions what we do unless there's something really bad and that happens. And nobody knows how we operate or what rules we operate under. So we have to get the community, we have to get the politicians to take an interest and to get educated and to really see, numbers. When you're billing out, like for instance, for us, we're large, but we bill out over $18 million. We collect $5 million. So how can you continue to operate at such a loss? It's impossible. Steve said it. It's almost $500 to roll out the door. It's $500,000 to staff an ambulance with an ALS provider, one ambulance, 24 hours a day.
And that's at current wages.
Right, and that's
Not
at current, that's
competitive
right.
wages.
That's at current wages. That's what it costs, $500,000. So we have to work within these budgets, or we're out of business. And the plans are great, right? And we see this all over. And it was discussed in Fulton County. Is the county's going to have an ambulance service, or they're going to have fly cars. The problem is, where are you pulling the providers from? The only place you're pulling them from is you're going to pay them more money. You pull them from the other companies, the private companies, which in turn is just going to create that system into some sort of a spiral downhill, and you're building another bureaucratic system. So, we worked with Fulton County for 3 years on putting a plan together in numbers, and we know that it's a stepping stone, and we certainly know that plan is going to change at some point in the future when it comes back to renegotiate, but they had to do something. We looked at the numbers, we looked at the dollar amounts, we looked at the waste in using the ambulances, and it really comes down to making EMS a field that people want to work in. And again, with $15, $16 an hour, it's never going to happen. So I could sit here and speak all night and give you statistics, for hours, but that's not what the goal is. The goal is to get together more frequently, at least as a committee, and that's what we're doing with Steve and Shannon, and put together a plan that is going to make us sustainable, not just in Montgomery County and Fulton County and wherever else we cover. We cover large areas, and we're not the only county facing it, like you said, right?
Yeah.
Schoharie County, every county around us. And when we look at mutual aid, there is no mutual aid. That mutual aid is not coming because they're in the same positions that we are. They have no staff. So again, the key is making EMS a profession that people want to work in, and that, again, requires money.
Yeah.
So.
Yeah, no, I agree and appreciate you sharing that. I can tell you this, and as some of our legislators this year have been out getting petitions, because they're all running for election this year, this has been an issue that has been brought up to them a number of times, and actually one of the legislators brought it up at our last board meeting. So, they were happy to hear that we were getting together and the work that was being done, more in-house. But yeah, it's been very interesting to see how counties are grappling with it, because clearly the model is not working right now, whether it's for the provider or for the residents.
And each county is going to be a little bit different,
Yeah.
Matt, because the counties have different demographics,
Yeah.
different resources available.
Mm-hmm.
If you have a county that has a large hospital system in its county, say like Otsego County, where an ambulance service might be able to supplement their 911 service by doing interfacility transfers. I mean, that's what's happening. I'm sure that's what Tom and Shannon are doing, is they're subsidizing the 911 system with their transfers. And if those weren't there, the 911 system wouldn't exist.
Yeah.
Was doing some of the research. New York City EMS, which is probably the largest EMS provider in the state and one of the largest in the country, they have a $600 million operating budget. They bill for services. They're only recouping $180 million out of their $600 million budget. So they're tax subsidizing that with $420 million every year. So, there's one of the largest systems in the state and probably one of the most proactive and more efficient systems, and they can't make it work on fee for service.
Well, let me ask you a question then. So I was reading over, what they did in Wayne County and, kind of just trying to look at their options, and they're, a few steps ahead. I think they hired a private entity to come in and look at it, and they were obviously much smaller numbers, but I think they were talking about on an annual basis that they would project about a $500,000 loss every year based on the numbers that you're saying, not loss, but that would be the subsidy from the county. Based on what you're saying, do you think that's a little bit pie in the sky if it's a $6 million operation to only be about a $500,000 as far as the county subsidy goes?
My guess would be that that's probably not accurate, Tom. You're
No,
probably
so every county demographics is different, right? So Montgomery County's got a very high elderly population, which is Medicare, primarily Medicare, right? 50-something percent, 52 or 53% is Medicare. You have another 21% of your population that is on Medicaid. So when you start looking at the fees for service, okay, so we put a cost to everything. So at $500, just say roughly $500 is what you're collecting, or what it costs you. You're not getting that. We're getting 10% less than cost on every Medicare call. On every Medicaid call, we're getting 52% of what it costs us. So those are huge numbers to overcome. And then you look at other things in the county.
Your no-pays.
Your no-pays, right. You have, 9% of people don't have insurance and just don't pay the bill. And, you've got to combat that. So you rely on your HMOs or pray for car accidents so that no fault, because that pays 100% of your bill, within reason, obviously. Yeah. But you rely on those calls. The transfers, the other problem that we are faced with here is we don't have only to worry about 911 calls. We have small community hospitals, whether it's Nathan Latour in Gloversville or St. Mary's. So now you start looking at things that, okay, we bring a patient to a local hospital, well, now they need cardiac services, they need stroke services, so now they have to go to Schenectady or they have to go to Albany. Then we'll compound that, all right, because we still have limited resources. We have wait times at those hospitals that are ungodly, 45 minutes at Ellis, 2 hours at Albany Med. Then you get a 911 call, you don't only worry about the transfers, because now they've transferred that patient down there once before, and guess where their doctor now is? In Albany or in Schenectady. So the next time they call 911, they're not going to St. Mary's, or they're not going to Nathan Latour. They're going to Ellis, or they're going to Albany Med, which takes ambulances out of service for 3-4 hours at a rip. So this is not staffing is the only problem. There are many layers of what is straining the EMS and ambulance system. People didn't understand COVID. COVID, every time you have a patient that is suspected of having COVID, that ambulance is out of service after the call. By the time they get to the station, they have to decontaminate everything. You could be out of service for a half an hour after you get back to the station doing decontamination. And again, when you only have a certain number of resources, all of that stuff comes into place, and it's going to delay response time. The staff, 52%. I'm at 52% of the staff that I need to work. My staff that are working crazy hours and overtime. At some point, fatigue becomes a factor. And we've all been fortunate. Every ambulance agency is in the same position, and they're running their staff ragged, and we can't continue to do that. And again, until we can fix that problem of making it a profession that people want to work in with higher wages.
I think one of those challenges of recruiting the staff is not only the wages, but like Tom said, the fatigue. The ambulance services are doing a fantastic job managing their resources to make sure that we get ambulances. But the cost of that, and not the dollar cost, but the personnel cost, is that EMT and paramedic, instead of getting to go back to the station and have some downtime in between calls, if it happens to be a slower day, instead of that, they're sitting in the front seat of the ambulance at the corner of walk and don't walk all night long waiting for the next ambulance or the next call because their resources are limited, and now there's only one ambulance left covering 2 counties, and they're sitting at the county line up by Walmart.
Yeah.
Because there aren't enough ambulances, enough people to staff those ambulances. Thank God, we've been so lucky, and these guys have been doing a fantastic job jockeying around these resources, and we've only got a 1.5% of what we consider not optimum. It won't take much to break that.
Yeah.
And we're talking about the other things that are contributing factors too we talk about delayed responses. For instance, inflation right now. A year ago today, my fuel bill was $10,000. Last month it was $21,000. And that's because we're moving ambulances all around. We can't take that hit when we're already losing money. So what does that mean? That means that when the Fort Plain truck goes out, maybe that Fonda truck isn't moving to Fort Plain because it's just wasted miles, empty miles, unless there's a call. Those are all things that have to come into play. The cost of fuel, the cost of the energy, our power bills. I mean, it is skyrocketed in adding hundreds of thousands of dollars to our budget. Nobody thinks of those things.
Yeah. Shannon, do you have Shannon chance?
So I think it's great, and we really appreciate that everybody's standing up here and saying that 1.5% slow in response times is great. But let's really go back and look to a year, 2 years ago. There weren't delays in response time. So yes, that 6-month period of time is okay, but it shouldn't be okay. It shouldn't be acceptable because 2 years ago we didn't have delays in response. Ambulances were getting to people a lot faster. So we should always be striving to have that better response time. It shouldn't be okay to have any delays in ambulance responses. Ambulance in Montgomery County, I'm sorry that I have to say it, but EMS has always been that ugly stepchild. The fire service in Montgomery County has always been a priority. I look at St. Johnsville. Nobody bats an eye to pay the fire department in St. Johnsville how many $100 and something thousand on their tax bill for a fire department that does 139 calls in 1 year. But then when an ambulance service goes to the town of St. Johnsville and says, hey, we need a little bit of support, the town supervisor, Dominic Stagliano, has a meltdown about it. When literally St. Johnsville Ambulance is getting 10 times the request for service. So at some point you have to really, you have to realize that EMS is needed, it's necessary, and it needs to be supported. We can't continue to operate at a negative constantly. It catches up to you, and as Steve said, ambulance services are going out of business, and we can't continue to survive. It's just not possible.
Well, let me ask you a question, because that's something that I know I've discussed with the gentleman here and even among some local electeds. The issue of, okay, whose job is it to provide that supplemental support? Is that a local municipality? Is that a city? Is that a town? Is that the county? And, and because, as you said, it has never been written in stone as a service that needs to be supportive, it seems like the buck gets passed a little bit. And you also have, I think, differences amongst communities on what the expectations are, which is why, for me, originally, it seemed like, okay, well, if a town wanted, to improve their response times, then, they already have, mutual aid agreements and designated operators, that they would do that. But as time has gone by, what I've felt like I've seen is that this is not something we're going to see from towns. Would you say that's fair to say?
I mean, I can only say who we've approached, and certainly we are not being supported by our towns. Other counties, towns have supported, but it's not happening in Montgomery.
I do have a thought on that. I don't think that the town level is the proper level for that to be at, because I think that may create another, I don't know if competition is the correct word. If you have an ambulance service or a couple ambulance services serving an area that has a town that has a lot of resources versus a town that doesn't have a lot of resources and is able to give an entity a better budget, then that's where they're going to be committed to. I think this needs to be handled on a larger level to make sure that the community as a whole is well served.
And I would tend to agree with you. I think all calls should be equal depending on what, and not depend on what the reimbursement rate is or whatever it may be. And I think no matter where you are in the county, you should be treated equally. So
Well,
I would tend to agree with that.
It's a great theory, but we have to be realistic about that too, because we're rural. And if you look at the volume of calls that there are in the different communities, you're going to have to at some point decide what you want to pay to cover that. Because to put an ambulance in the town of Amsterdam where they do more calls versus putting that $500,000 a year crew at the Charleston Firehouse to answer 3 calls a month.
Yeah.
I mean, that's fine if that's what the county wants to pay for and that's what they expect, but we need to be realistic too. The other thing I want to say, just on top of what Shannon said, was about the fire service and the money that they get. I personally believe that every dollar that they get, they more than deserve for the services that they're providing and probably deserve a lot more. It's just, we use that as a comparison to show that this is one part of emergency services that doesn't receive any funding.
Gotcha.
We're not saying that the fire service
Correct.
gets too much and we should be taking it away and giving it to EMS.
Correct.
They do a fantastic job with the amount of money that they get. And we need to expand on that.
And I just want to add one thing, because obviously I support the EMS and I think they do a great job. But we're forgetting one thing, the fire service is mandated. Police
Yes.
are mandated. So the volunteers, the money that we get on our volunteer services, we don't get a dime of that. I don't get paid, let me just finish. I don't get paid anything to drive my vehicle to the firehouse. I don't get paid anything for my 4 or 5 hours that I spend there. It's all volunteer. All the volunteer departments that are in here today, none of the volunteers get anything. We get a $200 tax credit a year for what we do. EMS, I get it, you're in a crisis, we all know that, that's why we're working on this plan. But as volunteers, you can't compare an ambulance service to a volunteer fire department. I understand we get paid. We get paid to buy our fire trucks, our equipment, our supplies, stuff like that. We don't get anything reimbursed to us for any of the time that we spend there, any of the fuel that we spend to drive back and forth, especially nowadays with the fuel prices. So just want to, not trying to downplay the EMS, I'm just trying to make everybody aware that
Let me
EMS
ask
is
you a question. I want to elaborate on that. What would happen if there were no volunteers?
Right, and so here's your thing. So let me be clear that I'm a fire chief, so I'm well
Right.
aware of this, but what makes law enforcement different from EMS? Because they do get paid and they are supported by taxes, so what's the difference?
I guess what the difference is that the state legislature has never made it a mandate, and I
Right.
think that Matt.
That's why we're here talking.
Right, that's what we're here
Because
talking.
nobody has that responsibility.
And we can't bill for our
Right, and
service.
you can't, and neither can
So
the fire
there's a couple
service.
differences.
So,
Right.
Every time we go to a house, we don't bill
I'm not trying to get
them
into
for a
a
deputy
debate.
responder.
Right. But I think, Jeff, imagine if your department was,
I understand, Steve.
needed to run based on billing.
I just answered the question.
Right,
that's all.
yeah.
And I'm sorry, Tom, what was your question, if there's no volunteers?
Right. They would have to pay them.
Right.
They would have to pay for fire service because it's a mandated essential service.
They would have to, but right now, that's why we're doing what we can on EMS, and with the help of emergency management and the sheriff's office, we're putting boot camp programs together. We have CFR classes that are running in Montgomery County to try to offset that, so it makes it better. We're trying our best. It's not a whole solution. It's not the answer to everything, but we're trying to make a solution. That's why we're here tonight, to try to come up with ideas.
We run EMT academies repeatedly to try to recruit and to train. We pay for that training. Tens of thousands of dollars for, some of these classes. The problem is we can't recruit because it's such a low wage. And the volunteers are gone. We saw that, right? That's why Fonda collapsed.
So, once you become a fireman, do you ever have to retrain and recertify, be licensed by New York State every 3 years?
Do I?
Does anybody that's in a
No.
volunteer fire
No,
department?
we're home rule.
So you're not, so to be clear, you don't have to recertify, relicense yourself every 3 years and go to training. Once you become a exterior fireman, that's it, you're done, right?
No, that's not true. There's continuing education.
But who regulates that? Are you regulated by any state agency that has to have licensing like we do every
No,
3
we're not.
years?
That requires a license.
We're taking it in. The other thing I wanted, Jeff and I understand volunteer versus, but you're both 501c3 corporations, you're nonprofit corporations. But I think what's really important here for our fire service partners to realize is what we're doing here is going to impact the fire service 10 years down the road. Because 10 years prior to this, EMS was operating the same way as the fire service was. And now that's gone. We had volunteer ambulances that billed or relied on donations from the community. And they were completely staffed by volunteers, and that's gone, and that's why we're here now, because we didn't foresee this happening. Now I think we have the opportunity to try to fix EMS, but also I think the bigger picture is for the fire service to pay attention to this, because if the volunteers go away in the fire service, we're going to be having the same meeting 5-6 years from now trying to figure out how we're going to fix the fire service.
That's why we're being proactive as we sit here today of trying to put boot camps together, trying to get our younger kids for juniors and seniors from our high schools to get in these boot camps, to try to go out to the schools and other organizations to try to get these people in, because we know we've lost a ton of people. I'm not trying to downplay the EMS at all. I'm just trying to differentiate between EMS and a volunteer fire department. I keep hearing that, and I understand, Shannon, believe me, I understand. You're a chief of your fire department. I was a chief of my fire department. I understand what you're saying. But we've got to look at two different entities. You're a private organization.
So are most fire departments.
How are we a private organization? You know what? I'm sorry, but
Yeah,
I think we should.
We're getting a little off topic.
Yeah.
It's a natural transition, and I'm Tony Grest, I'm the fire chief in the city.
Joe, real quick before you go, if we need divine intervention, Father Neil is here.
I wanted to back it up a little bit, just as Steve did. 1966 EMS, the white paper came out in 1973, the EMS Systems Act. Before that, it was the funeral homes who were going in hearses and picking people up to go to the hospital. The times have changed drastically. And from initially the ambulance services started out as all volunteer community organizations. And you had EMTs, then the standard became paramedics. And then the equipment that's provided, 12 leads, telemetry, intubation, all the skill level was raised up, which increased the training time, which increased the costs and everything else. And then the volunteers stopped volunteering, and you had to pay people to do it, or it was just not going to exist. So we had those issues, and like Steve said, volunteer firefighters could very well be on the same path that EMS was. If we backed up 60 years, there was hardly any paid ambulance services, especially in this county. It's a little before my time, so I would have to defer, unfortunately, to Steve.
Thanks.
But if we back up and look at that, and then Jeff had mentioned something earlier, another problem that hasn't been mentioned yet is last year in the city of Amsterdam, we did 3,500 responses total, fire and EMS. We had just over 3,000 patient care reports generated. That translated to 1,792 billable calls. Now, GADAC had another 396 out of those, but it still leaves us short of 2,200. Another 800 calls that we went on, there was no money collected. There was no even bill sent. It was either a patient refusal, it was a lift assist, or something like that. The system, I'm not going to go as far as to say it's broken, but it's on its path to being broken. People call 911 for anything, and they expect two paramedics or a paramedic and an EMT to be there with all the equipment, just like they were in the emergency room, at all hours of the night, no matter what time it is. They don't go see their primary care doctor. They don't go to a clinic. So that is also something that needs to be looked at, and we've tried to do it with a flyer, and it's not unique to us. It's not unique to this area. It's not unique to the state. It's across the country. That is what is happening with the system. And until we can figure out a way that we aren't going and doing every little thing for every person, and hopefully priority dispatch might help with this a little bit. One can only help or hope, but these are some of the other issues that we're having. I mean, am I wrong on?
So a perfect example is the sheriff has been great with us. Is we talk about these lift assist, right? It's a public assistance. The call literally comes into 911 that someone slipped out of their chair. They're not injured. So why does that make it a medical call? They're telling you point blank that they're not injured. Mm-hmm. So it's not a medical call, but guess who gets dispatched to it? The ambulance. Yeah. So those types of things, we get, and that's a good one. Some of them, it's just help getting them out of a chair and into a bed. Some of them, it's help going to the bathroom. That can't be an ambulance. But And then we talk about call volumes. Since COVID hit, our call volumes are through the roof. So our staffing's down, call volumes are through the roof, and we've put out the flyers to try to eliminate some of that. Montgomery County has stepped up with the 941s and the lift assist, which has helped tremendously. I mean, those are hundreds and hundreds of calls that we're literally wasting resources on.
We still have an over 20% increase in 911 calls
Correct.
so far in 2022 compared to 2021.
And let's remember that the big cost and the big challenge for EMS isn't necessarily running the call, it's being prepared for the call. It's having that ambulance sitting there when the person calls 911 so that they don't have to wait 28 minutes for the cardiac call. You know, one of the programs that they have going on in the country now, they're sending paramedics or EMTs out in fly cars to handle low acuity calls so that the ambulance doesn't have to go. Well, while that's a great idea to handle some of those low volume calls that you might not get paid for, that doesn't relieve that ambulance service's responsibility for still having enough ambulances sitting there waiting when somebody calls 911. You know, just because somebody else handled that call doesn't mean that, you know, like Jeff said, 5 minutes down the road, we're not going to get 7 calls at the same time. You still have to figure out a way to have your resources prepared to handle what the community expects for a response.
Now, another point to town, the low wages of EMS, roughly how many providers do you have down?
66, roughly.
If you had to guess out of those, how many work at more than one agency?
100% of them.
100% are working more than one EMS agency, doing a 12 or a 24, sometimes a 36-hour shift, to leave there to go drive to another agency to do another 12 or 24-hour shift. Think about that for a second.
So the better question is how many hours are those providers working a week?
Right. I mean,
Probably 90 to 100 hours a week.
easily, and it's been that way for years.
Yeah, I mean, when I was still on the road, working for a private service, I was working well over 100 hours every week just to make ends meet, because the ambulance services couldn't pay the wages.
So I just want to add 2 things, and these aren't to be controversial. That's not true. We just need to talk about history a little bit and perception. So I believe we are somewhat of our own worst enemy to a bit of an extent. So years ago, we had a few agencies in this county that were all volunteer, completely volunteer. And yes, volunteers started to diminish a little bit, but when that started to happen, we smelled chum in the water. And the paid agencies came in and they hung their hat on the general municipal law section, and they went to town and village meetings, and they ran the volunteers right out of business because they got the towns and the villages to choose them as the first in ambulance. So it caused volunteers to completely get out of the business. Maybe they were heading that direction anyways, but those volunteers, when they were true volunteers, their response time was probably very similar to the response times today, if not even a little bit longer. But when these paid agencies came in, they did a phenomenal job, and our response times decreased drastically, the service improved, and there was a big difference.
The level of care we see in the service.
Right. And that's not to criticize the volunteers that were doing the work forever for free, but they would have to drive from their homes in the middle of the night to a barn or to a garage or to a station, get a rig, then respond, and their level of training was simply that, volunteer. They were still professionals, but they didn't have that expertise and that equipment that the paid agencies had. So we've kind of created our own animal a little bit here, and now, you know, unfortunately we're tasked. We may have got to this point anyways, but I want to make sure that we all are on the same page and we're thinking about exactly how we got here and remembering some of those facts as we move forward, because that part of history is a true part of our EMS system and where we are today.
Bill, I'm just going to ask you a question. Very well said. Much more politically correct than I would have said it, because I was one of those volunteer EMTs 20 years ago from Mid-County. I worked my job, and I get to call at 2 o'clock in the morning, just like all of you people here do. God bless you all for what you do, volunteer firemen, EMS, whatever. But how did we get, in a relatively short amount of time, call it 20 years, from all these people that we had enough volunteers to, we never charged anyone anything, we took donations, that was it, and we were able to pay the bills to where we are today.
Do you remember what the call volume was 20 years ago?
At Mid-County, I want to say it was 60 or 70 a month. I don't know what that same geographic location would be, but that's part of the problem too.
So what's the call volume now? Because the people abusing, I'm going to say abusing the system for lack of a better term, improperly using the system.
It's probably, and it's going to sound a terrible thing to say, the same people that call 911 for the police and the sheriff are the ones calling. There's a relatively small group of people that are sucking all the resources for the county.
There are what I refer to as our loyalty customers.
Yes.
Are more than loyalty customers.
Are you giving them a loyalty card when you go?
They have a stamp card, just like
But my question was, is there a way to incentivize volunteers through a bigger reduction in their property taxes? $200, come on, you're gonna go to a burning building for that? I don't think that's really making a difference, but could the county do something in a bigger way to help volunteers?
Certainly sounds like something to consider, Bill.
To be honest, Bill, I don't, and I've been a volunteer all my life also in different agencies, and I understand where you're coming from, but the lack of volunteers isn't just in emergency services. You know, if you look at the VFWs, you look at all the other fraternal organizations out there that are trying to provide services for the community, they've seen a big drop in the volunteers. I think it's part of our culture. People aren't community-minded anymore.
I agree.
You know, when I moved into this county and I worked for a commercial ambulance service, and even at the commercial ambulance service, everybody that I worked with were local community people. It was all people that lived in the community. Tom, Shannon, now look at your workforce. 80-90% of it is people that don't even live here because they have to survive and they have to jump agency to agency and work these hours.
And I think that Steve's right with the culture thing. You look at people, you know, the unpaid positions, school boards, or even paid elected offices. The amount of people running for those things or volunteering to serve on a board has shrank drastically.
We have 9 legislators, and I think we might have 3 contested races this year.
Society as a whole, right? So as, again, we'll talk about inflation, everything's going up. People are working more than one job, they're working longer hours. So that also, depletes the volunteerism. And you don't have the stay-at-home moms like you had 20, 30 years ago that could jump on an ambulance or do the daytime stuff or whatever else.
Or the job will let you go to respond to a call.
Right, or the job will let you go to
work.
respond to a call. Those days are long gone. So, that's not today's world.
Yeah, when I started in the volunteer fire service, I lived in a community that had factories that had shift work. So there was always somebody in the community home that wasn't working a shift. These factories ran 24 hours a day, so the guys that worked night shift were the guys that volunteered in the fire department and the ambulance during the day.
Yeah.
That isn't there anymore. Back then, the people working for those factories, the family could afford to live on one income coming into the family. So the other people in the family could volunteer. That isn't there anymore. People that are working, they're working 2-3 jobs. They're not going to volunteer anymore. It's not happening. And I think that's horrible. I mean, the fire service is the one that's taken the biggest hit on it because they're the service that we have left, emergency service that's still relying on the volunteer force, and it's going away. I don't think there's a fire department here that can say they got enough members, is there?
That wants to show up.
Actually, I wanted to hear from some of the fire departments. You got anything else, Tom?
I don't believe so. I think that was it. I just wanted to give some numbers.
How's the city of Amsterdam been faring in general?
With call volume, EMS, what are you referring to?
Even staffing. I mean, I know even at the county, we're having a hard time getting applications. Everyone's dealing with staffing issues. A lot of the discussion of EMS reminds me of nurses.
And the career fire side of things, we're all fishing in the same pond. Everyone is cross-filing when they're taking a civil service exam for 4 or 5 different agencies. So that the same people taking the test in the city of Amsterdam are taking it in Gloversville and Johnstown, and the city of Schenectady, Saratoga, Niskayuna. So I have a person literally that is on 6 or 7 different lists. Just by the time I get to them, to see what other fire departments already contacted him to see if he's been offered a job.
Which kind of speaks to the point earlier about, kind of all, whether it's a county position, a private position, it's all still the same small pool that you're trying to pull from. And bottom line is, if the wages don't go up, you're probably not going to be in the same position for some time. So we've had the opportunity to hear from some of our biggest providers. Is there anybody else that would like to chime in and share some of your thoughts?
I just had a question, and I guess I need an education on it. It doesn't really address the financial piece, but as far as enrollment and getting into the program, have any of the colleges in the state or senior high school, I mean, we all need science credits to graduate college. We all need science credits to graduate high school. Has anybody ever successfully implemented, we'll put you through an EMS course? I'd rather take an EMS course than a physics class than college physics, yeah.
You guys got any answers?
So, Suri Kovalskill, Tyler Walton just graduated. He's actually going to be testing out. He's an EMT, and I believe he just took a job, but I'm not sure the name of the ambulance. But he graduated from Suri Kovalskill EMT, and he's going next year for his paramedics.
So are they accepting that as like a core credit though? Like if I got to have a science credit, I can go through an
I'm
EMT?
not
It's an actual degree, it's an actual degree program. So paramedicine is an actual, you can get your associate's degree in
Oh, I
paramedicine.
wasn't talking about major, I'm just saying.
New York State last year also lowered the age, mainly because of rural EMS and volunteers, they lowered the age that you can be an EMT from 18 to 17.
Okay.
But locally here, no classes. The other problem with that is we can lower the age, and that may work well for some volunteer agencies. But for instance, our insurance carrier, for one, says if you're under the age of 21, you can't drive. So I can hire a 17-year-old, but they have to be in the back of an ambulance for every single call, and they're only an EMT, and I need a paramedic back there. So, locally, I would love to see the high schools start something like that, or BOCES run programs. That would be great. They're doing nursing programs. I would love to see them do an EMT program. Nobody is receptive to it, if you will.
Like it's, if you're obviously on like a fire science career track or something like that, by all means, they're going to have those programs, but I'm just saying as core credit. Can I swap out a biology class for an EMT program?
Yeah, they're colleges, if you're going to get your degree in paramedicine, you can do that.
Did New York State ever follow through with reducing the thing if you had a felony conviction, you couldn't become an EMT? I know there was talk of it because they were going to start giving prisoners EMT classes.
So they have not, you still have to apply, you have to go through a criminal investigation. Felonies automatically eliminate you. Misdemeanors, they will investigate and make a determination on that.
Well, that's a good segue, because a lot of what I've heard in our discussions has been about reimbursement rates, but what other issues do I need to be bringing up with, something with Santa Barbara and our senator?
Well, long-term issues, again, is the insurance reimbursement. That's something that's not going to happen right away. I mean, we've been fighting Medicaid increases for dozens of years, and they've gone up pennies.
Well, the time to strike is now, because I think the state has a surplus for the first time in a long time. So, I would suggest
those are being pushed, as we speak. That, again, you're working at a state level and a federal level.
Because we can, have the conversation about fire departments, EMS, and, how the sheriff can partner, but it seems to me that structurally, the system is broken, especially in rural areas, period. And without that big change that's across county borders, across regional borders, that we're still going to be having these issues in community to community across upstate New York. Is that fair to say?
Oh, absolutely. This is happening all over the place.
Yeah.
Not just.
And we're all struggling to try to deal with it on a local level with more limited resources, more limited capacity to make change, because you're still dealing with state regs and, which feels like moving a mountain to get it changed. It
is moving a mountain. So one of the things that's been in legislature is community paramedicine, right? Mm-hmm. Where we can go out and hopefully avoid those misuses of ambulances. Because how many times does, grandma get lonely at night and, pick up the phone and call just because they want somebody to talk to, so they dial 911 and we bring them to the hospital because they don't feel good. Where if you had community paramedicine that, again, we could go out and do services, help them with their medications, go out and look for different things so they don't have back mats or they have handles on their tub, help prevent injuries, those types of things. They've been in the legislature for years and years and years, and we can't get them through.
And what about these, as Rick said, the frequent flyers? It doesn't seem to be any accountability there. I mean, I have a 6-year-old daughter, and if every time she does something wrong, nothing happens, I've quickly learned that she will keep doing that same thing wrong. The sheriff has been doing a great job lately with welfare fraud. And, you defraud the system, you're going to get charged, your picture's going to be out there, and you're going to be shamed. I mean, is there any,
Adult Protective Services needs to really be able to have some teeth into this. So we have 2 patients in this county that we've transported between the two about 200 times in a 1-year period.
Wow.
And we have gone to Adult Protective Services, we have gone to every possible outlet that we could go to get these people placed, right? And 200 times is crazy for 2 people. And one of which was 140 of those, one person, 140 times. And guess what? We're still getting called because there's nothing that can happen.
Because when somebody dials 911, the primary ambulance service has to go.
Yeah.
And like Tom, the paramedicine programs are wonderful things to try to reduce call volume. But again, like I said, that does not reduce the responsibility of that ambulance service to be ready for that next call. You know, what Jeff has been doing, reducing the frequent flyer calls is fantastic. It takes that burden off the ambulance service, but they still have the responsibility for having that crew ready there for when the real call comes in.
Yeah.
So just to touch on that quick, there's facilities also in the county, in the city, whether they're facilities or whether they're organizations that provide services to people. They might have a policy that says, if someone's in a fall, they don't pick them up. So what do? They call 911. They basically keep passing the buck until it gets to 911, the 911 dispatcher has to dispatch EMS. They go to a facility that is receiving money to have a person live there, but they don't do anything about that person falling down. So they have a paramedic come and an EMT come to pick them up, sign a refusal, they get back in bed, and then turn around and go back to tie up that crew.
And I agree, and that could be part of that facility is also restricted by state on what they can do. Because I work for a company that if somebody falls, I can't pick them up. I have to call.
Now, is that a state rep that says you can't pick them up, or is that you, the owner of the wherever you work for, saying it's our policy?
That I'm not 100% sure of. Is it state?
You're talking about one certain agency. You're not talking about everything. You're talking OPWD. You're talking about OPWD though. Are you talking about a nursing home or an assisted living facility?
Assisted living.
That falls under OPWD?
Yes.
And then the other part of that equation is if that person doesn't get signed off and goes to the hospital, now we've incurred a cost to the health system to transport them to the hospital. They're getting an ER, the system is getting billed for the ER services that they probably really didn't need. And now the hospital's stuck with them. They have to figure out a way to get them back home because the facility won't come and get them. If it's nighttime, the non-emergency transport companies are closed down because they receive even less money than the ambulance services do, so they can't afford to even be open at night. So now they're relying on, will the ambulance service come and get them and take the chance of getting reimbursed or do it for nothing? Or do they sit and take up that bed in the ER all night long until those services open up in the morning?
So, which is interesting because an assisted living facility has a doctor, right? That is the doctor of the patients who reside there?
We run under nurses, who
Okay.
obviously run under
Run under a doctor's license, and each agency here has a medical director, and we work under their license. So that doctor isn't going to take the responsibility, or if it's a state reg, then it gets passed to us, and then we have to go do it, and then have them sign the refusal and say that, oh, okay, they were fine when we picked them up and put them back into bed, even though there might be 3 or 4 staff in the room with the person.
We worry about the same thing with 911, chief. So I even said to the providers one day in the EMS meeting, why can't we educate 911 dispatchers through priority dispatch? If they say they're not injured, I just need somebody, to not send an ambulance. But there's no way we can tell on the other end of the phone. Do they need an ambulance or do they not? So there's no way we can put
And
the
that's
county
what
in that
kind of
position.
scares me a little bit, is I'm from South Minden, we border several counties. We rely on our farmers to staff our fire department during the day. And we're all fighting to keep financially stable personally, that we can't leave our jobs during the day. So it's hard for my members to get into EMT courses and stuff like that. I think if we could have courses, even for this time, that are more available to the working person, weekends, I don't know, weekend classes, something, so we can at least be prepared, because our community is going to be screaming at us while they're waiting that 25 minutes that's not bad time because their child's seizing. We're doing CPR for 30 minutes because we have to wait for that ambulance, and that's nobody's fault.
Yeah.
But the fire departments are gonna get the wrath from that, from the community, because they don't get it.
Well, that's part, and that's one of the things that we need to do to educate the public, and that's part of and it's our own fault. Not every ambulance call, not every 911 call needs an ambulance in 4 minutes. Actually, very few of them do. And many of the calls, and Jeff has been proactive with this with the priority dispatch, which I think is a fantastic thing, because the county looked at it back in the early 90s and abandoned it. But Jeff has been very proactive to get it back going. If we can triage these calls and then educate the public that, yes, you fell and you twisted your ankle and it's swollen, it's okay for you to wait 30 or 40 minutes for an ambulance, because that ambulance needs to go to the guy down the road having chest pain. We've never done that.
And maybe if it is a state reg with OPWD, maybe that's something to bring to the assemblyman or to senators and see if they keep passing the buck. It stops with EMS every time.
Yeah.
Maybe we can get something like that looked at or changed.
Well, it sounds like we got a pretty big list going here.
And they're not like they need a snack bag or something. And where I work, we are able to pick them up and not necessarily call an ambulance right away.
That's where you work. I have no idea where you work.
It's situational.
Yes.
I'm not working with Government County. So I'm not sure,
It's situational. It really depends on the person, the situation, and what's going on.
Certain facilities have their own in-house policies.
Right.
Yes.
It's a liability thing, and that's why they dial 911, because then the liability's on someone else.
A lot of them won't let you just sign off. They got to go because they
Right.
I've also heard that one, yeah. Oh, no, they need to go to the hospital. Another witness fault.
Right. Right, well.
They're in an
that's the
assisted
other
living
thing.
facility, they're competent. They can get up and leave
We've
anytime
run
they
into a
want.
lot of that, and I've actually spoken to a few that have shown up in ambulances, and I know it's just not a known fact. A lot of the individuals I help take care of are not able to consent for themselves. They can tell you information that happened 100 years ago, and they're extremely smart people, but they're not competent enough to sign off for themselves. So I think we've also lost that in our kind of community, that they're not just people that every day can talk about their own medical stuff and know exactly what's going on. They can't sign for themselves. So if I can't get that permission from a guardian or whatever to sign them off, they have to go.
You guys have a nurse on staff 24/7?
Huh?
You guys have a nurse on staff 24/7?
Yes.
So a nurse is a higher level of care than a paramedic or an EMT. So why is the liability passed off to a lower level of care? Why couldn't you guys just perform the same liability sign-off that we're going to perform on scene?
I can tell you my opinion on that, and that's from working with nursing homes, because the commercial service that I worked for did a lot of non-emergency transports. And one of the big issues that the nursing homes, and this is in the past, I don't know if it's 100% accurate now, but in the middle of the night, if a person fell or had a minor medical emergency, when they called the physician on call that covers that nursing home, that physician's reimbursement was so low from Medicare to come in and see that patient that his answer is send them to the ER. Because
Could that be something that they change at their level of their policies for nurses to be able to sign off without talking to the doctor, just like we would do?
I would think that would be prudent, but I don't see it happening.
I'm sure nowadays with the telemedicine things, maybe they could just set up a video conference and get a doctor on the screen.
You would think so, but I know that.
And it might be well above our head at the state level that things need to be looked at.
I know in the past that with the nursing homes, when they were bringing in, like when the doc would come in to do his patient assessments, they would schedule 30 patients a day.
All right.
Because it wasn't worth it for him to come in and do one or two. Because the reimbursement was so low, he came in and did 30 of them at once. So I think that's part of the problem why in these facilities in the middle of the night, nobody's willing to take responsibility for it, because they want to get paid for it, so they say, let's send them to the ER.
And they don't want to get sued either.
Yeah.
Exactly.
Well, and let's be honest too, not all facilities are created equal. I mean, you got a private pay facility in Guilderland you're paying $6,000, $7,000 a month out of pocket versus a building full of, Medicare, Medicaid type patients. You're going to have different, and judging by what you're saying, and we talked about this a couple of years back when you gave me the numbers, I couldn't believe, the number of calls that were Medicaid, the number of calls that were unbilled, and I think that speaks to Montgomery County's challenge as being a little different than some of these more affluent communities, because these issues that may not be an issue in some other communities are in ours because of our demographics. So, but this is good, and we're gonna, really, like you said, like you talked about with the experience with Fulton County, I appreciate the work that's been going on behind the scenes prior to this meeting. We want to continue this discussion and see where it takes us, but I think this is a good first step. Thank you.
I just have one question about this essential service stuff. What does it take to get EMS into municipal law as essential service? I mean, I watch the news, I see the governor, making all these laws in a moment's notice. What would be the holdup, or what would be the plan to make that happen?
To me, I think just in reality, the holdup is probably a financial one, but I mean, it's just a big change. I mean, do you guys got any thoughts on that?
You have to get an assemblyman or a senator to draft a bill and sponsor that bill and get a co-sponsor. Then it has to pass the assembly, if it starts there, or the Senate. Then it has to pass the other branch, and then the governor has to sign it into law.
So is this not a big enough problem for New York State, not just Montgomery County, but the state?
I think we're getting there.
I'm sure you meet with...
I remember back when I was in the legislature on lobby day when all the EMS folks would come in. I've heard it talked about then. I think, we're reaching a point where it's becoming a crisis, and that needs to be something that needs to be considered, which is why I think we want to add our voice to that discussion.
Here's my fear is right now we talk about this 1.5% or 1.25%. That's only because we're making it look easy. That 1.5% could be 75% tomorrow.
Yeah.
Literally tomorrow.
Yeah.
Let me ask a hard question on top of what Mickey was saying. Is the delay in this process because our legislatures realize the financial impact that it's going to put on the state if they make EMS an essential service?
That's my gut reaction, if I'm going to be honest.
Because it's going to be, if it was, it would be a big dollar issue.
Yeah. I mean, even just, and I remember I was sitting with these guys and, just reviewing what some of the other counties have done. And, I mean, it was an eye-opening experience just for us. Rick looked at me like he was going to, punch me or something. I said, listen, I'm not saying we do it, but what would it look like, just because I'm trying to understand.
Demographics is the big thing. You look at an area like Syracuse, city of Syracuse, their demographics are so different that the ambulance services there pay the city for the privilege of operating because there is proper amount of money available to bill. City of Buffalo, Erie County, I think last I heard that the ambulance service out there pays the city like $7 million a year for the privilege of answering 911 calls.
Yeah.
But that's because the money is there for them.
Which goes back to what
they don't need
my personal opinion. We've talked tonight about the fire service, law enforcement, and EMS. To me, they're, for lack of a better way to say it, each branch is just as important. What's the difference between you have a domestic and you need a sheriff, or the house is burning down and you need a firefighter, or you're having a heart attack and you need EMS? To me, they're all essential services. And unfortunately, we're operating within a construct that they are not treated equally.
Age. Fire's been around since cavemen. Law enforcement has been around since the Wild West.
There you go.
Marshals and deputies. EMS is relatively new.
Yeah. But I mean, we've heard, we've heard with our national politics, healthcare is a right, all this other stuff, To me, it seems like like we were talking, what's more important than someone shows up when you call 911? So that's why we're here tonight. Obviously, I think as you said, we're not going to solve this tonight, but I think this is a good first step, and I want to keep pushing the ball down the field and trying to come up with some small solutions, just like Jeff has, and maybe, working with our, adult protective is another way we can partner and help out. I think I know what facility you're talking about.
I wasn't referring to anything specific.
No, but, okay, I got one in mind. I happen to see your vehicles there every day. But, I think, this is a good starting point, and we want to continue to do this. Is there anyone else that, has a topic that they haven't brought up, that they'd like to bring up today? Phil, I can't believe you haven't said anything. So there is a bill?
There has been for several years.
Okay.
It's just never.
That's really the next step. You know, we did invite our legislators tonight. I know it's budget season, so it might have been why they didn't make it, but we're going to be reaching out to them, letting them know we had the meeting and, you know, some of that outcomes and try to work with them as we go forward because, I mean, that's going to be a heavy lift. And, you know, as we know, sometimes in New York upstate, more rural issues don't get the attention that it deserves in the state legislature. So hopefully, you know, we can try to change that a little bit, but anybody else have anything you'd like to say, mention? Yes, sir.
So you all know, I don't have a dog in this fight. I'm one of the community members that really appreciate what you all do. And I live close enough to the Hageman Fire Department that I hear their siren or the Fort Johnson one. And there are times when it keeps going on and off and off. Because we don't have people in the community, like you said, Steve, with the VFW, the Legion, all these other areas. There's not enough people in the community willing to step up and be involved. And Sheriff, do you have enough people, dispatchers?
No. No, the applications have run dry.
Right, but I mean, you do that, but I mean, again, if you're trying to wean out some of these phone calls, you know, for the EMS and try and figure out, okay, what is really essential here, what is really needed, you know, and then they have to dispatch, they have to make that decision, the dispatchers do, right? They're trying to make that decision?
Well, right now, as it stands, they don't even have a choice. If they call 911, they take the information and they dispatch it out to the appropriate provider based on the geographical location.
Okay. And Tom, you mentioned something about a medical service that comes in and does lift care or whatever. What's that?
No, they call an ambulance.
No, I know, but you were talking about that there's an agency that can come in and
Paramedicine.
Well, paramedicine, it wouldn't be in that situation. You know, it's more preventative medicine. More than anything.
Being involved with those people that are your loyalty customers, okay, that could be there and help provide them. Because I'm going to go back about 40 years, and some of you remember this, that you had on your telephone, sheriff department, fire department, you know, ambulance. It was a separate phone number. And did everybody have those memorized so that they could dial that number if they needed those services? No. But how many people forget 911? So again, I just kind of bring that up because if you're looking for ways to try and, you know, maybe they're on a flyer that, okay, if you need this kind of service, maybe call this number, you know, rather than 911.
And we have had some assistance from the hospital with the customers, the loyalty customers, the people who needed help getting their medications. There's times we get a 911 call for somebody with a complaint at 3 o'clock in the morning on the 3rd floor. You know, we take them to the hospital for their complaint. They had an infection. The hospital, the doctor there prescribes them an antibiotic. The next day, 2 o'clock in the morning, they call back, 911. Same complaint. Okay, well, they tell you at the hospital. They give me a prescription. Did you get it filled? Well, no. And so they didn't do anything that they were told, and then they just keep the process going of calling 911 to go back to the hospital to get 2 pills instead of actually going out and filling their script.
I can share a story with you that happened to me years ago. I was a night clerk at a motel that happened to have a bar there. And a gentleman came out to the desk and said, can you call me, you know, medical services because I'm diabetic and I'm having an episode. It didn't look too bad, but back then there was no 911. And the only ambulance service was through the hospital. So I called the hospital and told them what the situation was, but it was not an emergency. Well, the police department shows up and so does the ambulance, and I got chewed out. I said, when I called it in, I said it was not an emergency. Because the guy was just standing over looking at the catalog record. You know, so, again, I just bring these things up because as you're all trying to figure out a way to weed out some of those loyalty calls, that, you know, there might be, I guess I'm thinking out of the box and that, so thanks for listening.
But let's just not forget that as we weed out those calls and we take away those non-EMS calls, that makes rural EMS even more challenging. Because the less calls that you have, the more challenging it is to be ready for the call.
Gotcha.
Yes, Matt, I can say
I do.
I'm Bill Van Goor, Town of Mohawk Fire District. I have a hard time cleaning up blood on my kid, so that's off to you. I can tell you, I'll just bring you up to speed. This is Ben, he's with our fire district. We've had extensive conversations recently. We were in it, we were out of it, we realized the problem. And I do think that the problem really starts with the fact that there's no statutory requirement that gives us direction in the state on how EMS is supposed to be delivered or where the funding is coming from. It's the model, right? We have to search for the model that's going to work best for us. It's probably going to take us a little bit of time to get there. But it would be good for us to hear from the EMS side. What's your vision? What's the perfect world? Maybe we hear all the problems, but what's the perfect vision we got to work to? And how do we get there?
Yeah.
I can tell you we've had discussions on our board about, and it's just discussions. It isn't like we're pursuing any of this, but, our option is, maybe we can cut a contract with the city of Johnstown. Our option is maybe we can buy ambulances and hire paramedics, and I understand there's problems here. But it needs to be put on a bigger platform like it is here, because even if we did all of that, it doesn't serve the entire town of Mohawk. We've got the east end of town, it's not our responsibility. So we as a fire district want to be supportive, we want to help move this problem, we want to eliminate this problem, is what we want. So, but I think you should have more of these. The fire service is right hot on the heels of having a broken model, and if we can solve this collectively at the county level and work together moving forward, I think we can all be a little more successful.
Thank you, Bill. Well, that's the goal, and I think, my understanding is you guys have been working on some ideas, and we're going to bring them forward, and maybe what we do is, look at some of those as it comes out and take it from there and just continue this conversation. I know there's a lot of things that we've highlighted tonight that we want to continue to work on, and let's face it, it's going to cost money. And, that's...
I just ask that we continue these. I mean, we last met 2.5 years ago. It took us 3 years to work with Fulton County, and we kind of set a good model up there. But we don't have 3 years.
Yeah.
I'm going to tell you, we don't have 3 years.
Yeah. Well, I'll tell you this, it's certainly a top priority for me. It's a top priority for our legislature. I've been speaking with them. The chairman and a couple of the others have given me the direction to pursue solutions. And that's what we're trying to do. I know Jeff and our EMO team has been certainly working on that, and that's exactly what we're going to do. So I appreciate everybody taking the time tonight. I appreciate everybody being very respectful. We even had a few laughs along the way. And, if anything comes up along the way, give my office a call, give Jeff, Rick, Jeff, our deputy sheriff, who always speaks way too much. And, we're happy to listen and happy to try to be a partner. And I appreciate everybody showing up tonight. So thank you very much.